The Volunteers in Medicine Clinic opened in 1995 as a collaborative project with the Martin County Medical Society, Martin Memorial Health Systems, and the Martin County Public Health Unit. Its founder, Dr. Fred Carter, had been a private practice physician in Martin County for several decades. Dr. Carter saw a need for health care for those who work for a living, but neither have insurance nor the financial resources to access primary care. Through his efforts at the legislative level, the state of Florida streamlined its procedures for licensing volunteer physicians by granting them sovereign immunity. Martin Memorial provided a facility for the VIM clinic and a small paid staff who assisted Dr. Carter in recruiting volunteers to run the clinic. The Martin Memorial Auxiliary donated $310,000 to remodel and relocate the clinic to its current location, and Martin Memorial additionally provided operating funds. In 2001, the VIM clinic separated from Martin Memorial and obtained its own 501c3 as a charitable organization. At this time, the Martin County Board of Commissioners joined the Volunteers in Medicine Clinic as a supporter. The VIM clinic has grown to service 1,000 patients and has over 10,000 visits each year, with 85 volunteers rotating through each week.
The Volunteers in Medicine Clinic provides free health care to the working poor and indigent of Martin County. Please join me on a tour of our very special clinic. This is our reception area, and these are a few of the patients that we will see today. In the course of a year, we will provide up to 10,000 patient visits. This is the area of the clinic where our patients are greeted by our personnel and assigned to an appropriate room where they will meet their doctor and nurse. After qualifying, each patient receives a complete history and physical exam from a primary care provider. Screening lab work is ordered and a treatment plan and preventive care plan is established. Some specialty care is provided on-site in this specialized room. Procedures include those in gynecology, urology, dermatology, and podiatry. Ophthalmology and ear, nose, and throat care is carried out in this treatment room with its specialized state-of-the-art equipment. Other specialists will consult on our patients in their own offices, and surgeons will operate on our patients at Martin Memorial Hospital through their generosity with no fee to our patients. Medications are provided to our patients at low or no cost. In addition to what you see here, which are samples from community physicians, we have the opportunity to obtain drugs from pharmaceutical houses which have patient assistance programs. Continuity of care is most important in the field of medicine. To this end, we provide annual mammograms for patients. We do prostate screening. We have protocols for the treatment of basic cardiac disease and diabetes. It is our goal to provide the highest quality of care available to our patients.
Neva Newton, a college graduate who lost her job due to a physical disability, recently sought help from the VIM clinic.
Hi, my name is Neva Newton, and a few years ago I started becoming ill. I lost my job, so I had no insurance, and I was very frightened. I was showing symptoms of what I later learned was Parkinson's disease. So someone told me about the Volunteers in Medicine Clinic, and I came here for treatment. I could hardly walk. I didn't know what I was going to do. I was very frightened, and I met the people here. They're very dedicated. The doctors and nurses here were able to help me with tests that I could not afford without insurance. They gave me hope for a future. And I would not have had that without people who are this devoted to human life.
It is so rewarding to work with this group of patients who truly appreciate and value the care they receive at the Volunteers in Medicine Clinic, and also to work each day with a group of wonderful professional volunteers.
Neva is just one of many who have benefited from the Volunteers in Medicine Clinic. This could not happen without the support from our community.
In 2001, my fellow commissioners and I established a partnership with the Volunteers in Medicine Clinic, resulting in an improved level of service at our hospital emergency rooms. This enabled our indigent population to receive quality health care at a reduced burden to our taxpayers.
As a practicing physician, I am very aware of the plight of those who work hard to make a decent living for their families. For some, whether because of income restrictions or their employers are not able to give them health insurance, find it impossible to afford health insurance.
VIM takes up this lack of health insurance by providing totally free health care to these people. And because of this, we've become very involved with VIM, and we are very happy providing financial and professional help.
When we learned about the important work that Volunteers in Medicine does and its need of support, we got involved to help keep the clinic in existence.
We both felt that the Volunteers in Medicine Clinic was more than worthy of our support. We will continue to give the clinic our support both by participation and in fundraising.
We would like to thank all of you whose contributions have helped to sustain us.
We ask for your continued support. The growth in Martin County has increased the numbers of those who need our care.
As a nonprofit organization, the VIM Clinic is very aware of budgeting and finances. In a recent audit, it was determined that 97.9% of the VIM Clinic's budget goes toward program services, and 2.1% goes toward administrative costs.
For a budget of $540,000, we provide over $5 million worth of care for our patients.
The Friends of Volunteers in Medicine Clinic and their Volunteer Gala Committee host an annual fundraiser that provides 40% of the clinic's annual budget. The Gala has become the most sought-after social event of the season, attracting movers and shakers in town. And now, after successfully running these galas each year, it has achieved sellout status. The Gala also gives an opportunity to promote what the VIM Clinic does best, providing quality medical care to those less fortunate in our community.
Our goal is to enroll and care for every eligible person living in Martin County. Thank you for your attention.